great to see everybody out here supporting healthcare. I've got a little quick story I'd like to share with you today. A story about a woman that worked hard all her life. She was taking prescription medication for several different issues that she had. Come to find out that she wasn't able to afford one of those prescriptions. If she would have let her loved ones know that she wasn't taking those prescriptions because she couldn't afford it, I'm sure one of those members of that family would have stepped up and bought and paid for those prescriptions. In 2007, that woman lost her life. Heart failure. One of the reasons for that was because she wasn't taking her prescription for high blood pressure. That woman happened to be my mom. So it's very personal for me that we across this country take care of each other, and a start by doing so is health care. I don't want anyone to experience what I had to experience and put my mom in a better place too early in life. She was 60 years old. There's no reason anyone should lose their life that early. Everybody should have health coverage in this country. I thank you. I ask for continued support.
Thank you. Hi, my name is Tamika Pierce. I'm the Florida president of ACORN. I just came back from Washington, D.C. on a delegation for HCAN. My thing up there, what I got a chance to speak about was my health condition. In 2007, I was diagnosed with systemic lupus. It's an autoimmune disease where your immune system attacks all the organs inside of your body. I also have stage 3 kidney disease. I was working for the state of Florida and I had Blue Cross and Blue Shield, so I did have insurance. But the problem with my insurance is that I couldn't afford it, because on that insurance you have to see specialists. Well, I have to see specialists. Each specialist was $25, not to mention the co-pays that I had to pay for each medication. My problem was that although I had good insurance, I couldn't afford it. Had there been another option for me, something that was affordable going along with my pay, it would have been better for me. Sometimes I had to opt off between feeding my children, getting medications, sometimes not even being able to go to the doctor because I couldn't afford it, which landed me back into the hospital. My friends had to do a scooter ride for me to raise money for me to pay for my medications, but I was a working mother and I still couldn't afford it. So that's why it's so important today that we lobby our congressmen. That's what we did when we went up in Washington, D.C. ACORN did. We sent 900 people on a delegation to go talk to our congressmen about the problems that we're having down here. And one of the things that the congresspersons didn't know is that people have issues, even though they're working, they still can't afford it. Not to mention people who don't have insurance. Some of us are suffering racial disparities in our communities with insurance. Some of us are suffering disparities between money, classism, a lot of things that we're going through. So we got to let our people up in this building, Mr. Nelson, our congressperson, know that we need public option. People that work every day need a public option. They need to be able to afford their health care. So what I'm asking today is for Congress to put health over wealth.
That's right.
2009, we want health over wealth.
Health over wealth. Health over wealth.
It's very, very important to us, not just us, as well as our children and grandchildren. And it is important for us to lobby people such as Mr. Nelson, who has not taken a positive stand on healthcare reform. And I know that's why we're here today. We're talking about our livelihood. We're talking about our way of life. We have members in our union who are 55 to 64. They can't even buy health care insurance. They're caught in that gap until they're eligible for Medicare. And unless we work hard and speak to our representatives, they will not get health care until we do something, help them to do something about it. That's one of the reasons that we're here. And we're also here because we are tired of having those in the Medicare Advantage plans receiving more than those who are providers in the traditional Medicare plan. there is no reason why they should be reimbursed 14 to 17% more than those providers in traditional Medicare. And that is why we're here today too, to level the playing field. There are some of our representatives who feel they are not for a public option. Oh yes, we must have a public option.
That's right.
Unless we have a public option, there will be no competition for these private providers. And until we do something, let them know, if we raise our voice and let them know we do have something to say about this, that we want a public option in there, and that we can have one. If we call every representative we have in Congress right now, and they do represent us, they're representing themselves, they will soon get the message, because we will let them know, if you don't vote for a public option, you won't be back the next time.
Right.
Seniors vote, all of us vote, and we as a people must stand up for what we feel is deserving of us. We're not asking for handouts. We're asking for a public option so people can buy into a plan that they can afford. Some of your representatives will tell you that they're tired of it is not a handout. And we must get that message through that we want an option to choose the plan that we feel fits the necessities of our families. And that is why we're here today, delighted to see each one of you, and this will not be the last time that we will gather for this issue. And I thank you very much.
Yeah.